58 is going to be EMS operations, and it's a pretty cut and dry chapter. So I'm going to move through this fairly quickly because if you can read, you're going to get about as much information as me just reading these to you. So we're going to move through this process pretty quick. Common sense goes a long ways with most of what we're going to be talking about here. First thing that they're going to talk about are the different kinds of ambulances. There are going to be three types of ambulances, and then a medium duty ambulance, and then specialty vehicles. You're going to find that as you work in these ambulances, some are easier to work in than others because you're going to have more room. So the first one is going to be a type 1. It's going to have a box mounted onto the chassis. It's going to be a truck style. It's going to afford you usually the most room to work in. It's going to give you usually four-wheel drive, allow you to get around a little bit easier. They're also going to be the most costly. Type 2 ambulances are going to be van-style ambulances, so you're not going to see a separate box mounted to the chassis. You're going to just see a straightforward vehicle. You're going to open up the back doors. There's going to be a cot. Looking at this compared to the last slide, you're going to see that it's obviously much smaller. You're going to find that it's going to have a lot less room to work in. It's going to be difficult to run calls such as cardiac arrests in it. It can be done, it's just more challenging. These ambulances are generally good for things like inter-facility transfers. They're going to get better gas mileage. They're going to be a little bit less expensive. They're going to last quite a length of time. They're going to ride smoother. Those are some of the advantages of it. Type 3 ambulances, similar to Type 1, this is going to be a van-style chassis with the box mounted to it. It's going to be very similar to the Type 1 in that usually you get a little bit larger box on it, so it is a little bit easier to work in. They're going to be middle of the road as far as costs go. The disadvantage is usually it's only going to be rear-wheel drive, so if you're in an area where you have winter to deal with, it's going to be a little bit more challenging getting around those times. Drives fairly smooth. It's going to give you the extra set of wheels on the back for stability. Beyond that, it's like I said, it's going to be similar to 1, bigger than Type 2. A medium-duty ambulance is going to be a box mounted on a bigger rig, basically. So it's going to be more of a semi-type chassis, large truck, small semi-type chassis. Sometimes you're going to need specialty licenses to drive these units. It's going to give you all the advantages of a Type 1 and Type 3. It's going to be a little bit rougher ride than what those are. However, everything is beefed up in it. So the transmission, the braking, things like that are all beefed up in it. So if you're working in larger cities, sometimes you'll see these because the mechanical issues are going to be less when they have such stop and go traffic and they're utilizing them quite a bit. Final unit here are going to be the specialty response vehicles. Your service that you work on may or may not have these. You will have some probably in the area to use as resources. So these are going to be things like hazmat trucks, specialty trucks that might handle mass casualty situations. Generally speaking, they're going to be non-transport units. They're going to carry equipment, supplies, personnel. It's important to understand that the ambulance supplies and equipment are going to be your responsibility at the start of the shift. So you have a certain list of equipment that perhaps your service requires. You may have another list of equipment that your system requires, and then there's going to be a list that your state requires. Annually, your ambulances are inspected by the state. If you have issues where you're missing things, you can be fined. Your ambulances can be taken out of service, or potentially your ambulance service could be shut down. So it is very important to restock, make sure all your equipment is operational, and that you maintain everything. It's important that you know where everything is, because when you get into a stressful situation and you're going to look for something specific, it's easy to kind of forget where it is. So the more you understand where things are, the easier it is when you're put in that stressful situation to be able to locate it and utilize it. As soon as you get on shift, make sure that your ambulance is ready to go. Do a quick once over of all the main equipment, and then you can start going through things piece by piece, because you never know when you're going to get a call right out of the gate. Hopefully the off-going crew leaves you with everything that you need Good teamwork is essential in passing these ambulances off from one crew to the next. So inspect that vehicle and equipment at the start of every shift. Your shift that's off going, you want to have a face-to-face, because if they had a late call or whatever the case may be, you want them to be able to tell you, hey, we didn't get this, we didn't get this, so you know what's missing, you know what you need to take care of. Even if they tell you everything's fine, in my experience of 20 years of doing this, you're going to find that you will find things that are missing, things that they forgot to restock, things that were oversights, whether it's just strictly an oversight or whether it's they're really not a good employee and it's common for them. Ultimately, that ambulance is your responsibility, though. So if you go on a call and something's missing and there's a bad outcome because of it, that liability is going to fall back to you. There's two components to inspecting these rigs. It's the vehicle component, which is when you're checking the mechanical functions of the vehicle so that it's road ready, and then the equipment component, which makes sure all of your equipment and supplies are ready to go for patient care. Like I said in the beginning, you guys can read these. I'm going to run through them fairly quickly. So inspect the body of the vehicle. Make sure you report any damage that may be evident. Remember that if you don't report it and the next crew does, guess who's going to get the blame? It's going to be you. Inspect the wheels and tires. Understand that there's a lot of weight on these vehicles, so you want to make sure that there's no potential for your tire blowing out, anything along those lines, because it can be very dangerous if you're traveling at a high rate of speed and you lose a tire going down the road. As always, check the windows and mirrors, make sure everything's in place. Check the operation of all the doors and latches. Some of your equipment is going to be in outside compartments, and I have seen it to where a compartment door will freeze up and you can't get into it, and if you get to a scene of, say, a motor vehicle accident and you need a backboard and all of a sudden you can't open that door, it becomes an issue. So make sure you're checking everything, make sure you can get into everything and inspect everything. It's a very straightforward list of recommended items that you should inspect, but it is important that you do inspect them, take a peek at things. So check all your fluid levels, your oil level, your transmission level, your brake fluid, your coolant, any fluids that you have in the vehicle. Make sure to take a quick peek at them, make sure that they're at the levels they need to be. Check the battery, make sure the battery connections are good. You don't want to lose power when you get to a call. Usually you have an inverter that runs a lot of equipment in the back, so if your batteries go out and you lose power to the ambulance, it could become a significant issue. Inspect the interior surfaces and upholstery for damage and cleanliness. Wipe down things with an appropriate disinfectant. Make sure that there's no tears in any of the fabric, because if you do have a patient that's bleeding, you don't want any of that material getting into a crevice that's going to contaminate the ambulance to a point where it has to be taken out of service. Check the windows for operation and cleanliness. Test the horn, siren, emergency lights. If you're the driver, make sure that the seatbelts work. Make sure you get the driver's seat where you need it so you're ready to go when the first set of tones drop. Make sure you check that fuel level. Generally speaking, most services will say if you get below half a tank, you need to make sure to fill it up. You want to be able to have enough fuel in that ambulance to run at least a couple calls, and then when you have some downtime, make sure to get it refueled. Get that key turned on, make sure you're checking for indicators, make sure there's no problems with oil pressure, engine temp, check over the vehicle's electrical system. Take a look at those dash-mounted gauges for proper operation. You want to make sure that the fuel gauge is working, and any gauges that have needles that would go into the normal range, make sure that they do float up into the normal range. If not, either check it yourself or find somebody appropriate to check, make sure that that's okay. Check the brake pedal. Note the pedal travel. If you're in a vehicle with air brakes, make sure to check the air pressure on that. Like we talked about earlier, these vehicles are bigger, they're heavier, they carry a lot of equipment, and you're going to be responsible for you, your partner, and a patient, potentially a family member, in that ambulance when it's moving down the street. So brakes are very important. You want to make sure that they are fully operational and operating to where they need to be. Check the parking brake just in case. Put that transmission into a drive position, and then put that parking brake on. Make sure that it's holding in place. When you get on scene, sometimes these vehicles will have a high idle so that the batteries don't wear down. Potentially, you have to usually set the parking brake, and then that high idle will kick in. So make sure that you're familiar with your vehicles and if they have that feature as well. Check on the steering wheel, just give it a tug side to side, make sure that it's operational. Check the windshield wipers, make sure there's washer fluid in there as well. Give a peek over the blades, make sure there's no tears, anything in the rubber that scoots across the glass. Check the vehicle's warning lights. Make sure to look at the turn signals, the brake lights, the driving lights, all of the emergency lights. If there's any issues and you can fix them, get them fixed. Otherwise, make sure to report them. If it's something that the vehicle needs to be taken out of service, then you need to make sure to talk to your supervisor. Make sure to check the heating and air conditioning. Most of these vehicles are going to have a separate unit for the front and a separate unit for the back, so make sure that you check the back as well, especially if you're in conditions where you could have either heat emergencies or cold emergencies. You want to make sure that you have the flip side of that working so that you can properly care for your patient in the back of the ambulance. Check the onboard suction. Make sure that it's functioning properly, but you also want to check your portable suction, and it'll talk about that later. That's going to be your backup. Check all of your communications equipment, whether it's cell phone, mobile radios, your portable radios. Make sure everything's working properly. Do a radio test with your dispatchers if need be, if that's what your policy states, to make sure everything's working properly. Newer vehicles are going to be equipped with a backup camera. Make sure that that's working properly. That does not basically give you the pass on having somebody spot you. You should always have a spotter as well. Then when you return to quarters, make sure that you have somebody check that the backup alarm is working. It is very important. It's a huge liability when you're backing these things up. You don't want to accidentally back over something or somebody. Now we'll migrate over into the supplies and equipment. Same concept though. You need to just go through everything, make sure everything's there that's supposed to be there, make sure everything that's operational if it's equipment. Most services are going to have a specific checklist that they want you to utilize, so wherever you work, whatever your service provides, use that to do your detailed inspection and inventory of equipment and supplies. You want to check the supplies, the interior equipment, the exterior equipment, make sure that you're looking at the O2 cylinders, checking the pressure of them, whether it's your portable or onboard main. Test the action of ventilator equipment for proper operation. You should have multiple Christmas trees where your oxygen is going to flow from in the back of your ambulance, so kick that oxygen on real quick, check each of those trees, make sure that you're getting oxygen out of them. If you have rescue tools on your vehicle, make sure that you operate them. If they're battery powered, make sure the batteries are charged as well. Some equipment, such as AED defibrillators, are going to require additional testing. So make sure if you have any equipment that you need to do a user test on, that you are checking that daily so that that equipment is operational and you have a log, because if that equipment fails and you haven't done the user test, then that can fall back on you personally as a liability. Make sure to complete that inspection report, correct any deficiencies that you find. If you aren't able to correct something, make sure you report that to a supervisor. If you're following a crew that continually is an issue, make sure you're going through whatever your department's process is so that they can get corrected on their end as well. Make sure your unit's clean. Make sure that you disinfect things. Give it a once over. You want to keep this thing clean between each call, especially in today's age with COVID. There's a little bit more disinfection that goes on when you go through a call. Okay, we're going to move into when you actually receive a call now and start talking about just a little bit of this. So first thing to understand is when somebody calls 911, it comes into that emergency medical dispatcher. That emergency medical dispatcher is a very difficult job. It's a very stressful job, and they have a very set way that they do things. So they're going to ask questions of the caller. They're going to assign priority to the call. They're going to let you know if you need to run emergent, non-emergent based on the information they gather. If you feel like it's something different and your policies dictate it, you can override what they dispatch you to, but remember now that you've taken that liability and put it in your own hands, because it is dangerous to run emergent to a call when you shouldn't be running emergent. They're going to provide any pre-arrival medical instructions to the caller. So if somebody's in cardiac arrest, they're going to give that caller instructions on how to do CPR in the process for moving forward with that. They're going to try to attain all the information and pass it on to you as well. They're going to dispatch and coordinate EMS resources. So they're going to dispatch you, but if it's a multiple patient scene, they're going to have set policies in place so that they can get the proper number of ambulances coming as well. They're going to coordinate with other public safety agencies. So many times when you respond to a call, you're not going to be the only agency there. You might have police department there, you might have the fire department there. They're going to coordinate with those agencies as well to get everybody in place that needs to be in place. This is just a sampling of some of the questions that an emergency medical dispatcher might ask. Basically, when they take a call, they usually find out what the chief complaint is and they type that into a computer. Their computer system then has a program in place that spits out the questions that they need to ask. So if it's a chest pain, they're going to ask this list A questions. If it's a difficulty breathing question, they're going to ask this list B questions. So it's all computer based these days for emergency medical dispatchers. But they're going to get all of the information that you should need and hopefully pass that on to you. If you have specific information that you're looking for, don't hesitate to ask them. So if you're going to an MVC and they haven't told you number of patients, you might want to communicate with them to see if they have identified the number of patients that potentially could be at the scene. Because if there's more than 2 patients, obviously you're probably going to need a second ambulance. So at that point you can request a second ambulance. Hopefully they're going to get all that information and take care of it for you. We're going to have a whole pile of slides here on operating the ambulance now. So being a safe ambulance operator takes a lot. And the first thing that you need to understand, especially in today's world where everybody seems to be sue happy, is that liability is going to fall back to you as the ambulance driver. So you need to understand these things. You need to understand that there are times you should run emergent. There are times that you need to run non-emergent. You need to understand that driving an ambulance with lights and sirens on doesn't give you a free pass to all the laws. So first thing from a personal standpoint is you need to be physically and mentally fit. You need to be prepared to perform under the stress of potentially having a critical patient in the back, because you're going to want to maybe push it a little bit harder than what you should. You have to be able to reel in those emotions and understand that if I'm driving 10 miles an hour over the speed limit, it's really only going to save me a minute, maybe 2 minutes if I'm traveling 30 miles to the hospital. So excessive speeds really don't gain you a whole lot. Have a positive attitude about your ability as a driver, and don't be a risk taker. Ultimately, you're responsible for yourself, your partner, and anybody else in the ambulance, including the patient. So don't do anything dangerous. Don't pull out in front of vehicles thinking that they're going to stop. Make sure that they actually stop. Be tolerant of other drivers. It's easy to say, how did they not see me? How could they not hear me? But today's vehicles, they're so quiet on the inside. If you've ever had an emergency vehicle come up on you, sometimes it is hard to hear the sirens, and if you're not glancing in your mirrors, you won't see them right away. So be tolerant of them. Understand that if they see you, hopefully they're going to do the right thing. There are bad drivers out there. You just have to be cognizant of that. Common sense, never drive while you're under the influence of any substance. You're going to lose your license. You're going to lose your job. You're probably going to go to jail if you're operating emergency vehicles while you're under the influence. If you take prescription medications, understand what they are, understand that they can impair the ability to operate the motor vehicle, and understand that you can get hit with driving under the influence for prescription medications as well, depending on what the med is. If you have a suspended license, it should go without saying, don't drive. If you wear glasses or contact lenses and they're required for driving, make sure that you have them. You don't want any reason if something goes bad that it went bad. Evaluate your ability to drive based on your personal stress, illness, and fatigue. So understand that sometimes you may have to take a shift off if your brain's just not in the right place. And most employers are going to be very understanding of that. They're going to let you use your sick time, but they don't want you putting harm potentially in the way of your patient, your crew, anybody else that might be out there. So understand where your personal stress level is, if you've been sick, if you're fatigued, and understand if you should or should not be at work. Understand that there are laws specific to operating emergency vehicles, and there are kind of guidelines that dictate what's appropriate and what's not appropriate. So the first thing is with the driver's license. Each state's going to have different requirements to operate emergency vehicles. For example, in Iowa, you have to have what's called a chauffeur's license to operate an ambulance. In Illinois, it's not required. So you have to understand what's required of your state. Hopefully your system, your employer, your volunteer service, wherever you're at, will assist you with this. There are going to be certain privileges granted under the law to the operators of the ambulance that apply when the ambulance is responding to an emergency. So this is generally going to be if you're responding to a call with lights and sirens. There are some exceptions to the law. They're absolutely not applicable if you're not on a call. They're not applicable if you're not running emergent as well. You need to be running lights and sirens. Those two things go together. Understand too that even though you have these certain privileges, that doesn't necessarily take the liability away from you. So it's still ultimately going to be your responsibility for safe driving, safe travel. And again, just to reiterate, even though I just touched on these, those certain privileges granted to you during an emergency, they don't give you immunity. So you can still be held liable if something bad happens and you're found to be at fault. Usually it's got to be more of a negligent issue, but it can ultimately fall back on you. And then also, again, just to reiterate, you have to be using your warning devices, and you can't be using just the lights. The lights and the sirens go together. If you're using just your lights with no sirens, it's going to put you at an elevated risk of liability if something bad were to happen. A couple slides here just to talk about usually what the statutes do allow. So they're going to allow you to park wherever is necessary as long as life and property are not endangered. So they're going to allow you to park on the street, on the interstate, but within reason. They're going to allow you to proceed past stop signs, signals. Generally speaking, you want to still come to a stop, make sure everybody around you has stopped, and then proceed through. Don't just assume because you have your lights and sirens going that you can blow through a red light as fast as you want. You still need to come to a stop, make sure that it's safe to proceed through, and then slowly proceed through in a safe manner. You can exceed the posted speed limit as long as life and property are not endangered. This is kind of a catchy one because if you exceed the posted speed limit, aren't you kind of endangering the lives of the people in your vehicle? I would say yes. A good rule of thumb is usually 10 miles an hour. They'll usually say if you go 10 miles an hour over the speed limit, you're within those confines. But if you're in a 30 and you're going 75 miles an hour and a car pulls out in front of you and you T-bone them, you're going to be held liable for that. So you got to use some common sense. You got to understand what policies your department are going to dictate when it comes to safe driving and really most of these laws. A couple more here things. Passing in a no passing zone after properly signaling and taking the precautions. Again, it's taking the precautions. Make sure that it is completely safe for you to pass that vehicle. Disregarding regulations that govern direction of travel and turning with proper use of caution and signals. So it's going to say that, you know, if the only way to access the patient is to go the wrong way down the one way, then that's acceptable, but you have to do it in the proper, safe manner. If you're directed to respond to the call emergent, or if you have a critically ill patient and you're responding to the hospital emergent, again, make sure that you're utilizing the siren appropriately. Don't ever use it indiscriminately. You want to use it when it's appropriate. So with the siren is the visual warning devices. Like I said, you want to use one with the other. You want to use it regardless if it's day or night. You want to make sure that everything is seen 360 degrees around the vehicle. So that is one thing in your ambulance check. Make sure you're checking all of those emergency lights. Make sure that they're all functioning properly. A little bit on speed and safety here. Like we talked about, excessive speed does increase the probability of a collision. So when we look back on that slide a few slides ago where it basically talks about could you be endangering somebody else? Well, if excessive speed increases the probability of a collision, then really common sense says that you are increasing that likelihood that you could injure somebody. So be very cautious when using excessive speed while driving emergent. understand where you're at, what the situation is, and do it appropriately. The other thing to remember is, like we talked about a couple times, these vehicles are big, they're heavy. It takes a long time for them to stop compared to a regular vehicle normally. And when you're driving at a higher rate of speed, it's going to increase that stopping distance, uh, reducing the chance of avoiding hazardous situations. So you need to really understand the vehicle you're driving and how it works, what your stopping distances are. Make sure that you're keeping yourself and everybody around you safe. Slide here talking about escorted or multiple vehicle responses. And I do not personally recommend using an escort, or if you have multiple vehicle responses, try to get a little bit of space between you and the other emergency vehicle in front or behind you, just because it's so easy for other drivers to focus on that lead vehicle, and then once that lead vehicle clears, they don't even look for a second vehicle. So to me, it adds increased risk when you have an escort. I think you're better off driving in a safe manner, emergently, without that escort. If you're an inexperienced ambulance driver, it's easy when you have that police car leading you to the hospital to get too close, and then it becomes dangerous with braking with other vehicles, like I said, leading on that first one. Sometimes it may be absolutely necessary, and if it is, just understand that you need to use a little bit more precaution. There are a number of factors that are going to affect the response, depending on where you're at. If you're in a larger city and it's rush hour on a Monday through Friday, well, guess what? Traffic's going to be slower. You might be in that same spot at 2 in the morning on a Wednesday night, and there's no traffic. So understanding where you're located and kind of what the dynamics are of the traffic patterns around you can dictate almost to a certain degree your direction of travel to get to the call. So it might be quicker this time of day to go route A. It might be quicker this time of day to go route B. So you need to understand that. Things like weather, obviously, things like snow and ice, you need to drive slower. You need to take more caution. You need to understand with road maintenance and construction that you need to use great caution driving through those areas because there are still going to be workers out there. So even though you have immunity to some of these laws, there are certain times where I would still adhere to the laws, construction zones being one of those. Understand that you can be delayed by railroad crossings. If trains come to a stop on railroad crossings in your jurisdiction, make sure you understand the workarounds to get around that area. Usually there's going to be some place you can go to that you're either going to clear the train or be able to go under the tracks or over the tracks, whatever the case may be. Understand with bridges and tunnels, there's only so much room. And sometimes if you get locked up in traffic, it's easier just to shut your emergency lights off and go with the flow of traffic. Sometimes those emergency lights bottle things up more than what running without the emergency lights would be. So understand these situations as well. Understand school and school buses, and that sometimes kids aren't the most attentive. So if you're driving through a school zone, even if you have your lights and sirens on, use great caution. You don't want a child running out in front of the ambulance and you potentially striking them. Navigating to the scene, and this is kind of a pet peeve of mine when you have drivers that get in and they just take off. They have no idea where they're going. They have no idea where the call is. They have no familiarity with the area. Take a minute or two before you go en route to either utilize your GPS if you have one, which most vehicles these days do have them, or take a look at a map and understand how to get to your call. The flip side of that is you also need to understand when you get to the call, what's your route to get to the hospital. So make sure that you have that all in tune if you're the driver. Utilize your partner if you have to ask questions or to help you get the GPS set up. If you have a general idea of where you're going, maybe you can start while your partner gets the GPS going. But it is for me personally, it's a big pet peeve when somebody hops in there, they just take off, they have no idea where they're going. Let's take our time, let's get there as quick as possible in a safe manner. And just to reiterate on a few topics here, Minimize your lights and sirens hot responses. A lot of calls you don't need to respond to emergent when you're going to the call. An even larger percentage of calls, once you pick the patient up, you won't need to respond emergent to the hospital. You need to understand when it's appropriate, when it's not appropriate, because it comes with a high risk and you don't want to put yourself at unnecessary liability. Make sure that you're wearing your seatbelts. Your safety, as always, comes first. That was like the first thing you learned in Chapter 1. And again, my pet peeve, make sure that you know where you're going. Make sure to use the GPS and the maps. Just get familiar with your response area. If you're in an area that has quirky things, like roads that stop and start because of ravines or creeks or whatever the case may be, understand that you have to access this side of the road from point A and you have to access the other side of the road from point B. Those are all things that you have to kind of learn on the job depending on where you work and where you're located. Okay, safety at highway incidents. And highway incidents are very, very dangerous. In my 20 plus years of doing this, all of the close calls that I have seen for emergency workers either nearly being hit or vehicles nearly being hit have occurred on interstate highways because traffic just generally does not slow down out there. I've seen a cop throw his flashlight at a vehicle for not slowing down. I've seen chain reaction accidents happen because one vehicle slows down and another vehicle doesn't slow down. Interstate highways are just a dangerous area to respond to calls. Avoid crossovers unless you can make that turn without obstructing traffic. So if you got to hit that turnaround out there, make sure that you do it in a safe manner. Make sure that you can get turned around without completely obstructing the traffic. Make sure you're using the emergency lights when you need to. Protect the scene. If your unit is the first unit on scene, you want to protect the scene. So you want to pull up, kind of park at an angle so that you have maximum visibility of the most emergency lights as possible. If you have to, take a lane of traffic and get all the other traffic detoured over into the other lane, but you want to protect. Hopefully there's going to be a big red truck on scene before you get there or shortly after you get there, and they're going to take over protecting that scene for you. Make sure you're wearing your PPE. Make sure you're wearing those required safety vests so that you're maximum visible while you're on scene. If you have to and your agency dictates it, get those cone flares out and reduce the emergency lighting. It can be very distracting actually, especially at night with these new LED lights. They're just so dang bright that they kind of blind traffic as they go through. So if you have kind of a high level, low level lighting system in your vehicles, which some of the new vehicles do, once you get parked, turn those down so they're slightly dimmer. Your unit placement is going to be important. There are whole classes, and I highly recommend taking an emergency vehicle operator class once you get licensed and you're operating these vehicles so that you can understand more the importance of where you should park, how you should park, when you should park, everything that goes along with it. Whenever possible, avoid backing up. It's going to be just a dangerous maneuver in those big boxy ambulances. Hopefully you have a backup camera. It doesn't substitute utilizing a spotter. Make sure you always have a spotter letting you know if there's anything behind you. Go through the hand signals with them so that you guys are able to communicate and fully understand the movement of the vehicle. Handful of quick slides here on just transferring that patient to the ambulance. It's kind of one of those things that you need to be preemptive before you get to the scene, and then once you get to the scene, make some determinations based on where your patient's located, the house that you're going in. All those variables come into play. So you want to select the proper patient carrying device. You want to package that patient for transfer, get them moved to the ambulance, and then load the patient into the ambulance. It may require multiple things to do this. You may have to tarp your patient from the bedroom to the living room, put your patient from the tarp onto the stair chair them out of the house to the cot, move them from the stair chair to the cot, and then move the cot to the ambulance, load the cot in the ambulance. Today's cots, especially if you have power cots, they're much heavier than they used to be. So I always recommend, whenever you can avoid taking the ambulance cot all the way into the house, unless it's a simple process, set it up just outside the house at the base of any stairs. Utilize that stair chair if there's no trauma indicating that you should otherwise utilize a backboard. Put them in the stair chair. It's going to be your easiest extrication tool to get them out of the residence. Move them over to the cot, and then get them in the ambulance. Now, there are many variables to this. If your patient's critical, you're going to want to get them to the cot, to the ambulance as quick as possible so you can start rapid transport. You just have to use a little bit of common sense, kind of have an engineer's brain and how you're going to do all of this, and get them moved into the ambulance as quickly as possible in as safe as possible manner for the patient, but also safely for you. These are going to be the times where you're at the highest risk for injury, especially back injuries. Again, just readying that patient to be moved, getting them onto that patient carry device and to the unit, ready for transfer. It's a team effort. Usually one person's going to be assessing the patient, and the other person's going to be getting them the packaging process ready, unless it's a critical. Or if you have fire department there, they might be taking care of the packaging process. If you have a three-person crew, it kind of has its own variables as well. So just understand the dynamic of the situation that you're in, what resources you have to be able to move this patient. Also understand that sick or injured patients must be packaged so that that condition's not aggravated. If your patient's already suffering of hypothermia, you want to make sure you have blankets on them so that you can get them covered up, so that as you take them through more cold environment, you're not exposing them to even more potential of kind of exasperating that condition. Understand that it's not just to throw the patient on the cart, get them out to the ambulance. Sometimes there are certain things that you're going to have to do before you package that patient over to the cot. So you want to make sure that you care for any wounds or other injuries. If they have something that's impaled on them, make sure you stabilize that thing extremely well so that the jostling around, moving them to the cot, moving to the ambulance doesn't exasperate that condition and potentially cause something worse for the patient. Make sure you're checking any dressings or splints when you get them into the ambulance. Like we talk about, when you splint these injuries, that you want to check that pulse motor sensation prior to splinting, after splinting. Well, now that you move them to the ambulance, you want to check it again to make sure that nothing has triggered, a lack of circulation to an area. You want to make sure that everything's in place where it needs to be. Cover the patient, secure the patient to the patient carrying device. No matter what your patient carrying device is, you're generally going to have 3 sets of straps. It doesn't matter if it's a backboard, you're going to have 3 straps. Generally speaking, the stair chair is going to have 3 straps. Your cot's going to have 3 sets of straps. Your cot's also usually going to have a shoulder harness, depending on your model of cot. These straps are going to be kind of a chest level, a waist level, and a lower extremity level. If you have the shoulder harnesses, they're going to go over the shoulder, hook into the chest level straps. Make sure that you have them all in place, snugged up, whenever you're moving the patient. When it comes to your own protection, one thing that's really not mentioned here is moving the patient is when you're at the greatest risk of injuring yourself from a musculoskeletal standpoint, of hurting your back, twisting an ankle, whatever the case may be. So take your time, have a good process in place for moving that patient. Once you're in that patient compartment, that's when you're at the greatest risk. You want to remain seated whenever possible. You want to wear that seatbelt and harness whenever possible. Generally speaking, the rule of thumb is if you're not performing life-saving interventions, you should have your seatbelt on whenever that vehicle is in motion and you're in the back of the ambulance. Make sure that all your equipment is secured. That is also another huge thing with the state inspections, especially in Illinois, is that all equipment is secured. There's nothing loosely laying out among the counter, on the bench seat. Imagine an O2 cylinder laying loosely on the bench seat. You get in an unfortunate accident and the vehicle rolls over that you're in. Now that O2 tank has become a missile inside of there. It's going to start bouncing around, and if it hits you, it can cause greater damage. So make sure that all equipment is secured. A couple things with preparing that patient for transport. Don't let your assessment stop just because you're moving the patient. You want to continually assess the patient. And it can be as simple as looking at them for the ABCs, the AVPU, simple things like that. Make sure that their condition hasn't significantly changed. Secure that stretcher in place in the ambulance. There are laws that require ambulance cots to have certain mounting equipment when it's in there, so that if you do get in an accident, that cot remains secured to the floor, and the patient doesn't just become flopping around in the back of an ambulance while they're still attached to the cot. Position and secure that patient, adjust those security straps, and then be prepared for any respiratory or cardiac complications. So again, continually assess and be prepared for change. Loosen any constricting clothing, load a relative or friend if they must accompany the patient. That's going to basically go on your local protocols. I know with COVID, we personally limited that nobody could ride in the vehicle. We've loosened that a little bit since so that a relative can ride. Understand that best practice is to put that relative in the front seat, secure them in with the driver. That's going to be the safest location for travel. However, if your protocols and policies dictate it, and say you have a pediatric patient and it's going to be easier to care for that patient with the parent in the back with you, then that's going to be your own personal judgment based on what your protocols are. If they have personal effects, get them loaded up, make sure that they're secured. Understand that there's only so much room in an ambulance, so they can't be taking a suitcase, a wheelchair, a walker, a bunch of different items, but you're going to probably want to take the patient's medications. They may have a small bag of personal items that they're going to take with them, things like that. Make sure you're communicating with your patient. That's always key. Avoid letting the patient sit on the bench or the airway seat unless it's within reason, like if it's strictly a mental health evaluation. Sometimes we'll let them sit on the bench seat and secure them in. However, also understand that in those situations, if you put them on the cot with 3 sets of straps, if they're a mental health patient and they become a little bit rambunctious, that's 3 sets of straps they have to get off instead of just one. So it is best practice to put them on the cot, but if you do utilize someplace else in the ambulance, make sure that you secure them in properly. Make sure you notify the hospital that you're incoming. Make sure that you give them an adequate patient report. Make sure that you're continuing to provide the emergency care as required. Your assessment process is always continuing throughout the transport. You're always doing that ongoing assessment. Use safe practices, follow your policies, follow your protocols. If there's any additional patient information, make sure that you compile all of that so that you can pass it on at the hospital so that you can document it. Make sure that you're monitoring those vital signs, 5 minutes if they're critical, longer if they're not critical. Make sure that you notify the receiving facility as well if you're coming inbound. Depending on where you're at, the policy may state that you have to give a report to your medical director even if you're not going to that hospital, and then you may also have to give notification to the receiving facility. You don't want to walk in and surprise them with the patient because they're going to get irritated with you, and it's just going to make for a not smooth transition of care. From a pediatric standpoint, if they have to be taken in the back of an ambulance, it is generally speaking going to be a terrifying experience for that child. If they have a comfort item such as a toy, teddy bear, whatever the case may be from their own home, it's generally acceptable and a good idea to let them bring it because it's going to kind of calm that frightened child in the back of the ambulance. Sometimes it does help to have the presence of a female EMT or police officer, but not always. It's honestly kind of just a sexist comment, but it is, as a general rule, kids do seem to be a little bit more comfortable in the presence of a female over a male. Regardless, make sure you get to their level. Make sure you communicate with them. Treat them as a human being. Don't treat them as a baby unless they are a baby. But you don't want to take a 10, 11, 12-year-old and just treat them like a baby. Talk to them like they're a person. They'll be a wealth of information for you, and if you can get a good relationship with them in that short amount of time, It's going to make everything you do in the back of an ambulance a little bit easier. Look at things like, I know our ambulance service has little bags that a group put together for us that has a tie blanket, a little stuffed animal, a couple snacks for when it's appropriate. Don't be feeding your patient. Um, there's a coloring book, crayons, things like that in this little bag. So we can give this to the child and hopefully give them a little bit of comfort. Children generally don't carry identification as a rule, so if you don't have a parent there, it can be a little bit more challenging as well. You just have to do the best you can. Make sure that you're transferring the patient care to the emergency staff as you should. Understand that if you just take a patient in and you throw them in a room in the hospital and you leave, you don't transfer that care, and that patient dies before emergency staff get in there, you can be held liable for abandonment because you didn't properly pass on care of that patient. Generally speaking, when you get to the hospital, they're going to either tell you what room to go to or where to go to. So communicate with them when you get there or through your radio report when you call that in. Sometimes they'll just give you that information as well. Assist the emergency department staff as required. Make sure you provide them a verbal report. Even though you gave a radio report, that doesn't mean that maybe you have a different nurse that's coming in to take care of the patient. They didn't take the radio report. They didn't get the information. So you want to make sure that you pass on that information. Assist them in getting the patient moved from your cot to their bed, whatever the case may be. As soon as you're free from those patient care activities, start preparing that pre-hospital care report. Sometimes some services will utilize some sort of quick handoff sheet where you kind of quickly document all of the pertinent information from your call. You give that piece of paper to the nurse so that they have kind of just a baseline sheet of information from the patient care standpoint. And then when you complete the actual pre-hospital care report, it should be sent to that receiving facility to be part of their chart. If you have any of their personal effects, make sure that you pass those on as well. Make sure that you document that in your patient care report, that they've been passed on as well. You don't want to be accused of theft. I've seen it happen a number of times. And you also don't want to forget to pass it on and then get back to the station and realize now we got to drive back to the hospital because we have all of the patient's medications. If you have a signature form that needs to be signed, either have the patient sign it or have the hospital sign it so that that kind of is the final piece of handing off that patient care. Now that you've handed off your patient care, it's time to terminate this call. And there are certain things that you need to do. So you need to do a quick cleaning of the patient compartment while taking appropriate standard precautions. Wipe down your cot, wipe down any surfaces that may have had exposures, wipe down things like your blood pressure cuffs, your pulse ox cables, anything that could transfer and contaminate from one patient to the next. Prepare your respiratory equipment for service. Replace any of your expendable items like bandaging, anything that you've used that you need to replace, make sure you get it replaced. Exchange equipment according to your local policy. If you have batteries that need to be replaced, make sure that you replace the batteries. And then make sure that you get your cot made up. These are kind of all things that you're going to do at the hospital. So that way, if you get another call while you're driving back to the station, your response ready, able to go and handle that next patient. Once you've left the hospital, make sure to radio that so that the dispatchers know that your response ready and able to handle another call. If they get one, they can dispatch you to it. Air out the ambulance as necessary, and then if you get that fuel level down to a point, make sure that you stop and refuel. If there is something that you cannot take care of at the hospital that you can only take care of once you get back to your quarters or your ambulance base, make sure that you advise that you're going to be out of service for whatever reason, and then as soon as you get the issue taken care of, make sure that you advise that you're back in service. If you have an AED that the batteries have died on, you don't want to respond to another call until you get that taken care of. because you won't have an AED, and if it's a cardiac arrest, that's an essential piece of equipment that could add liability to you if it's not operational. So therefore, you want to make sure that you take yourself out of service, get it taken care of, and then get back in service. Make sure that you're utilizing the biohazard container for contaminated items, and make sure that anything non-contaminated goes in the regular linen container so that things can get taken care of appropriately. Once you get back to quarters, clean anything that you haven't already cleaned, or if you need to do a deeper disinfection on certain things, make sure that you take care of that. Clean and sanitize that patient compartment. In today's age, if you have an atomizer, now would be the time to kind of atomize it to disinfect everything, and then prepare yourself to be in service and handle that next call. Any items that you haven't already replaced as far as expendable, make sure to get those replaced. Make sure you're replacing or refilling any oxygen cylinders. Check your patient care equipment, make sure everything's still operational, all the batteries are where they need to be, and get those put back into service as well. Carry out any other maintenance procedures as required, and then clean the vehicle, complete your paperwork. When we say clean the vehicle, it is best practice to clean it inside and out. You want to be responding in a nice looking professional vehicle that's not covered in mud and dirt, covered in bugs, whatever the case may be. Not to mention the fact that if you continually clean it, it's going to make that cleaning process a whole lot easier than if you just let it build up through the entire day and then you have to try to clean everything at the end of your shift. Last topic that we're going to discuss here is air rescue. Basically, air rescue is going to be a helicopter is going to come to your scene. You're going to load the patient up in the helicopter, and then they can fly much faster than you can drive on a direct path from the scene to the hospital. So it dramatically decreases the time for a patient getting from point A to point B. Now, you don't want to use it all the time. It's very expensive and costly. So when do you want to use it? Well, when extrication of a high priority patient is prolonged, an air rescue can speed up that process. If you're 10 minutes from the hospital and it takes 15 minutes for the air rescue to get there, and you can load and go with that patient, does it really make much sense to wait for a helicopter to lift them, take them? No. But if you're 35 minutes from a hospital and you have 15 minutes estimated that it's going to take to extricate this patient from the vehicle, and an air rescue can get them there in 8 minutes, well, they could be on scene before you have them extricated. You put them straight in the bird, and now you've saved a tremendous amount of time. Also, when this patient must be rescued from a remote location, there's going to be times where you might not be able to get the ambulance to the scene, and you have to either hoof it back there with your bags on a significant walk, or take other sort of vehicles like side-by-sides, four-wheel drive pickup trucks, whatever the case may be, to get to the patient. You might want to utilize air rescue to get them out in those situations as well. As a baseline, some clinical reasons to look at utilizing air rescue. If your patient's in shock, if they have a Glasgow of less than 10, they have head injuries with an altered mental status, if they have chest trauma or respiratory distress, or if they have penetrating injuries to a body cavity. Now understand that the helicopter is going to be much smaller than the back of an ambulance, so they've got to be able to get this patient into the helicopter as well. Another good thing to think about is know what resources you have and what type of hospitals you have in your area. For example, where we are located, we have level 2 trauma centers. So they can handle most anything, but if it's something super serious, like you have a patient that has paralysis from the waist down, they're not going to handle that. They're going to ship that to a level 1 trauma center. So if your patient is stable, even if you're close to this level 2 trauma center, it may be beneficial for the patient to have the helicopter pick them up. It's going to be a smoother ride. It's not going to exacerbate that injury and potentially make it a permanent paralysis if it's something that could be repaired. But B, if your patient's stable, that helicopter is going to bypass that local facility. They're going to go straight to the level 1 trauma center and get them to where they need to be. So there are many variables when to utilize the air rescue, and it takes a certain amount of common sense when you're assessing your patient, or even when you're just responding to the call. If it sounds bad, there's nothing wrong with getting that helicopter either on standby or up on air standby, so that when you get there, you can kind of be ahead of the game and have them coming. More things. Amputation proximal to the hand or foot. If they have extensive burns, again, this is going to be those patients that you want them to go to a burn center. So they're going to bypass everything and go straight to the burn center. If there is a serious mechanism of injury, and then if the patient is post-cardiac arrest with a pulse, helicopter generally isn't going to take a patient if they're in cardiac arrest. Now, they're going to have times where the patient goes into cardiac arrest in the helicopter, but it's not a very conducive setting for them to run a code in a helicopter. So they want it to be a post-cardiac arrest. Patient has to have a pulse. Again, if you can load and go and get them there in a reasonable amount of time, it's going to be faster than waiting on a helicopter, loading them in the helicopter, getting the helicopter up in the air, getting them to the hospital. If these are going to be situations where you have a prolonged distance or a prolonged reason for getting to the hospital. Okay, how to call for an air rescue situation. And if you are in an area that has access to air rescue, which most areas do, I would highly recommend kind of pre-planning with the air rescue. Maybe have them come out, do their own training with you to explain kind of what they want you to do, how they want you to do things that they're looking for. They can walk you through their helicopter, the danger zones, kind of what the expectations are. But generally speaking, you're going to need a name and a callback number. You want to give them your agency name. You want to give them the nature of the situation and an exact location with any crossroads or major landmarks. So if there's railroad tracks nearby, if there's a river nearby, whatever the case may be, anything that's going to help that pilot get to your scene. You want to give them the exact location and description of the landing zone. The landing zone is generally going to be close to the scene, that you can walk the patient there, but far enough away that you're not going to have to worry about the rotor kicking anything up or causing issues on scene. If you have GPS coordinates, you want to make sure to get those GPS coordinates to them as well. You want to also make sure to give them any information on the landing zone and any items that could be of danger to them. So things like terrain, and their pilot will generally communicate with whoever your incident scene command is and maybe gets asked some questions. So if they're landing in a field, they're going to want to know, is the field soft, is it firm? Things like major landmarks. They want to know an estimated distance to the nearest town. Generally speaking, these pilots have certain paths that they like to take in certain directions, that they'll follow those landmarks. So if you can understand any of those landmarks to help them, that would be beneficial. You also want to give them pertinent information such as wires, any ditches, wind direction, any potential hazards that they may run into. If you have landing lights and you understand how to use landing lights, you want to use landing lights. Make sure to get that other colored light in the proper direction for the wind. Generally speaking, when the helicopter arrives on scene, they're going to make a circle around the scene. They're going to do their own assessment. They'll either land where you want them to, or they'll communicate with you that, hey, we want to move the landing zone to point B. They'll describe that to you so that you can assist them getting on the ground. Helicopter landing zones generally 100 feet squared. There's also specific directions that they want you coming into the helicopter. So there are going to be hot and cold loading of the patient. A hot load is when the helicopter is still fully functioning. The rotors are going. A cold load, they're going to shut down, and it's going to be a much safer, easier way to load the patient. More times than not, it's going to be a hot load. So the pilot will stay in the helicopter while the crew comes out, gets the patient loaded on their cot. Many times, that crew is just going to take the patient on their own load them by themselves. It's what they're trained to do. If they want help, let them dictate to you what they want, how they want it. They always want you loading from the front. The pilot wants you in his vision when you're loading the patient. They want you staying as far away from that tail rotor as possible. So if you follow the directions that are given to you and do what you're told by the crew of that helicopter, everything will be okay. When the helicopter arrives, don't approach it unless you're escorted by flight personnel. Don't be just pushing your patient over to them thinking you're just going to load the patient in their helicopter. They're going to want to bring their cot to you, get them secured down, and follow all of their policies and procedures. That crew becomes in charge of the loading of the patient. It's now their scene, their patient, and you do what they want you to do. Most importantly, always stay clear of that tail rotor. The vast majority of those tail rotors are enclosed these days, but you still want to stay clear of it. You want to stay in the vision of the pilot at all times. Keep all traffic and vehicles at least 100 feet from the helicopter. Understand that as they take off, that downdraft is going to start kicking things all around. You can cause damage to vehicles. It can be dangerous for people that are in the area as well. Goes without saying, don't smoke near the aircraft. You shouldn't be smoking while you're on scene with the patient anyway. And then just be aware of any danger areas. Use common sense when it comes to these things. Just follow instructions. And that concludes the first chapter in this last unit, being EMS operations. Make sure to look through the chapter review. There's 3 more chapters to complete this out. The unit quiz will be up. If you have questions, make sure to let us know. Otherwise, make sure that you're reading the chapter as well. These should go without saying. The PowerPoints that we put up with the audio is just to reinforce what you've already read. So make sure that you've read it, utilize your resources, utilize your Quizlets, go through the book. We'll see you at the next one.